Across Africa, the correlation between an efficient supply chain and health outcomes cannot be more pronounced. Primary healthcare centers across the continent operate inefficiently, leading to a lack of insights to effectively manage treatment outcomes via the supply chain. The results? Supply chain planners lack real-time visibility into consumption data at the last mile, leading to stockouts, overstocks, expired products, and wasted resources.
We look at digitization as a game changer. Before we digitized, it was based on paperwork reporting, and it will take us a lot of time.
We had enormous challenges. The entire system for Enugu was largely driven by paper-based system. It also made it very impossible and difficult for health leaders to be able to make data-driven decisions.
But this is changing. The introduction of solutions like Rural Health Operating System deployed in Rwanda and Elephant Operating System deployed in Nigeria are digitizing last-mile facility operations as a first step in the integrated supply chain journey, capturing timely consumption data that was previously costly and time-consuming to collect, and turning it into actionable supply chain insights. This will serve as a building block in developing an integrated supply chain framework focused on patient outcomes via stock availability in the pharmacy.
In the pharmacy, we could also track the near-date drugs, like close to expiry date drugs. We could also track that. And once you get that information, you could inform the officers there to, see that those ones are dispensed as quickly as possible. It will also always tell you that a particular drug is depleting and needs to be restocked over time.
Thanks to these solutions, last mile consumption data is now reaching supply chain planners and decision makers, transforming guesswork into data-driven forecasting and allocation.
Being able to click on the dashboard, either in my office or the office of the Honorable Commissioner for Health, and you're able to see what happens in facilities. And then you're able to also take some critical decision about whatever information you're able to pull up. Is truly exciting.
But gaps remain. While both systems digitize inventory management and forecasting, procurement and insurance reimbursement processes are still paper-based. Digitizing these remaining paper-based processes is a critical step towards building an integrated supply chain. Integrating the last-mile solutions with in-country national logistics, insurance, and payment platforms will unlock end-to-end visibility for improved decision-making. And this presents supply chain leaders with a strategic opportunity to leverage the data being collected today within and outside supply chain modules of last-mile systems, while exploring future integration with national platforms to unlock wider supply chain intelligence.